Okay, so I've got a lot of requests for how you do microneedling for hair growth. So I was going to show you. First, use numbing cream. Obviously, you have our numbing cream. I would definitely put that on for, I would say 15-20 minutes. Some people don't want that. Some people just want ice, but it's definitely the practitioner preference and of course the patient preference. So when you put on the numbing cream, you have to part the hair. You don't want to have too much numbing cream on the hair, right? Because then it doesn't go on the skin. So when you part it, just use either your finger or a Q-tip to apply the numbing cream and then part the hair again and so forth. Remove it thoroughly before you start to do the needling, and always use the 12-pin cartridge. I'm using the needle pen, the original pen today, with the 12-pin cartridges, because you want to go deep down, I would say 2 to 2.5 millimeter, because you want to go down deep to stimulate the whole the hair follicles. Okay, so how do we do this then? Again, you part the hair. This patient obviously have a lot of hair, but just a little bit thinning in the hair in the front, but I wanted to show you with someone that have a lot of hair. So you can, if someone have longer hair, you can of course use hair clips. Not gonna do that today. But you part the hair and then you do exactly like you would regular microneedling. I usually use PRF or PRP here, or if you have growth factors, but right now I'm gonna use our hyaluronic acid. So I'm gonna put a little bit hyaluronic acid just on the scalp. Just on the scalp there. So you see that? So you have some gliding. Then I'm putting on the pen. And I'm gonna turn it up all the way to 2 millimeter. I would not go under 1.5, because again, we need to stimulate the hair follicles. And when you do this, you can do it exactly like you do any face or body part. You can either glide the pen or you can stack it. So if someone have a lot of hair like this patient, I would maybe not drag the pen, but I will stack it. You just put the pen straight down and straight up, instead of just dragging it, because when you're dragging it, the hair can come in between the needles and the scalp, so you will not penetrate as deep. So you just stack it up and down, and as you can see, you get a little bit of pinpoint bleeding. That is totally normal with the scalp. I'm gonna turn the pen off for a little bit here. So what I suggest, to have ice, to ice it. This is an ice roller. It's really good for, especially when you do hair treatments. You just want to ice it in between. The ice sometimes is actually better than the numbing because it's instant. But again, you can use both. You will get pinpoint bleeding with the hair, but that's the process that you're doing. You're parting the hair, you're either dragging it or doing stacking motions. Sorry, I'm gonna show you stacking motions like this all over. Then you part the hair again and you go through the entire scalp or the entire area that you are gonna be, the patient's gonna treat. Okay, I'm gonna put some more text underneath here and a protocol as well.